cancer treatment has been a long-standing goal for medical science. Efforts made by oncology treatment specialists to further comfort patients have in recent years been supported by the method of hyperthermia. Hyperthermia works by raising the body temperature. It has been known since antiquity, and it is based on research by ancient Greek physician Parmenides, who said, "Give me the power to create fever and I can cure any disease." Using two different machines, we are able to increase the temperature within the tumor. Hyperthermia is the best stimulation for radiation treatment because it can multiply its effect up to 7 times. Besides, it has synergistic effects on chemotherapy, increasing its therapeutic results by up to 2.7 times.
Και μάλιστα μπορεί να αυξήσει τα αποτελέσματά της έως 2,7 φορές.
The combination of radiotherapy and chemotherapy is not always sufficient to control tumor growth. This is why hyperthermia is a truly significant method in improving disease control. Unfortunately, most patients receive hyperthermia at the final stages, yet, even then, the method has shown its potential. Ideally, patients should receive hyperthermia as early as the first stage of the disease to ensure better results.
Also die Hyperthermie, die Ganzkörperhyperthermie ist eine sehr wichtige Möglichkeit.
Full body hyperthermia is a combination of various things. It addresses the immune system, but also fights cancer cells. In the last 30 years, clinical studies have shown that full body hyperthermia can make an important contribution to cancer treatment. Particularly in the last 20 years, studies from around the world have shown very good results.
Die Beobachtungen und die eigenen Erfahrungen auch wissenschaftlich bestätigt sind.
Метод гипертермии очень давно и хорошо известен в России.
Hyperthermia is a method that has been known for many years. At the hospital clinic where I work, my professor assigned me to study this method, and so I have documented its potential. However, we needed to acquire the necessary equipment, and we achieved this when the Russian Health Ministry provided us with funds that allowed us to implement this method. It is known that hyperthermia has a direct effect on tumors, but always in conjunction with chemotherapy and radiotherapy. The method of hyperthermia is used at Thessaloniki Interbalkan Medical Center at specially equipped premises, similar to those of major oncology centers around the world. Specialized protocols are used so as to help and support patients suffering from various forms of cancer. Hyperthermia is considered to be the fourth pillar of cancer management. It is part of a multidisciplinary therapeutic approach, which exposes cancer tissue to high temperatures. Hyperthermia is used to supplement chemotherapy, radiotherapy, and surgery, thus increasing the therapeutic benefits for cancer patients. In the last 20 years, there have been at least 22 to 25 major comprehensive studies which all show that patients presented up to 40% improvement on average. This is confirmed by the daily application of hyperthermia at our practice. When the patient starts hyperthermia at early stages of the disease and combines hyperthermia with chemotherapy and radiotherapy, the results are much better. In 2008, a study was published by ASCO. The study was undertaken by Dr. Hager and me and included 200 patients with glioblastoma, a kind of brain tumor. Patient survival time was doubled because of hyperthermia.
Η τοπική περιοχική βαθιά υπερθερμία
Deep local hyperthermia is caused by electromagnetic radiation that increases the temperature within the tumor without affecting healthy cells. From our experience, we have had the best results with metastatic colon cancer to the liver, and, particularly, with cases of glioblastoma, as Dr. Sahinbas said.
εκεί έχουμε νομίζω τα καλύτερα αποτελέσματα.
Da muss man wieder unterscheiden zwischen den milden Ganzkörper.
When applying extreme hyperthermia, ovary tumors and pleural mesotheliomas show a very good response. In medium hyperthermia, which we apply here, immune system tumors show a very good response. For example, kidney cancer, when treated at the initial stages, has good results. We do not recommend monotherapy. Besides, all studies that have been completed concerned full body therapy combined with other treatments.
так много пациентов прошло через...
We have not been using the hyperthermia method for a very long time, and we have treated a small number of patients with it. This is why we have no official results to report yet. We hope that soon the usefulness of this method will become apparent and well documented. The best results are encountered among patients with cervical, esophageal and rectal cancer.
Die Ganzkörperhyperthermie hat in der milden Form
In medium hypothermia, which reaches up to 40.5 degrees centigrade, there are no side effects. If we talk about extreme hypothermia, where temperatures rise to 42.5 degrees centigrade, about 3% of patients may present some complications, but even those would be minimal complications affecting the skin.
Grad Celsius nicht gesehen.
Они должны быть, поскольку...
There are some complications due to the combination of hypothermia and chemotherapy, but they are a rare phenomenon.
Στα 5,5 χρόνια λειτουργίας που είχαμε,
In the 5.5 years of our operation, we have had 2 cases of mild burns, and this happened because there was a scar in the region and the patient had no sensory input from the tumor site. In no case does hypothermia reduce, cancel or interfere with the application of other oncology treatment methods. Most scientific studies that have been completed combine hypothermia with chemotherapy and radiotherapy with impressive results in both survival time and life quality of patients.